Most of the tobacco smokers nowadays know that smoking is harmful for their health. Many of them also know that smoking is also harmful for the people surrounding them. Many smokers also wish to quit smoking and are finding it difficult to do so. However, when you know about the health hazards of smoking and health hazards of tobacco, you have good reasons to quit smoking. Do you wish to know the health effects of tobacco? Then this video is the one for you. Hello viewers, I am Dr. Rabiul. I work as a lecturer in pathology in a medical college hospital, and I am making this video for my students and also for you. Today's topic is on the health effects of tobacco. This video will contain some introductory points regarding the health hazards of tobacco, and since tobacco smoking is the major culprit, so we will also talk about the constituents of tobacco smoke, followed by the diseases caused by smoking. We will also talk briefly about the relationship between smoking and lung cancer, and also between smoking and other diseases. And we will finish our discussion today by talking about secondhand smoking and how smokers can quit smoking. Okay, so a lot of topics, so let's begin. So first we will talk about some introductory points regarding the health effects of tobacco. And always remember, tobacco smoking is the most readily preventable cause of human disease and death. And not only tobacco smoke, but also smokeless forms of tobacco, for example, snuff and chewing of tobacco, are also associated with various diseases. For example, chewing of tobacco can cause oral cancer, as we will see. And in your textbook you will see that the majority of the smokers, or 2/3 of the smokers, are seen in 10 countries, and China is leading that list. 30% of the total smokers are seen in China, that is followed by India, where 10% of the total smokers are seen, and the other countries in this list will include Indonesia, Russia, the United States, Japan, Brazil, Bangladesh, Germany, and Turkey. And to give you an idea about the seriousness or the severe consequences of smoking, always remember that more than 4 million people die every year due to diseases that are associated with smoking. These people usually die due to cardiovascular causes, due to various forms of cancer, and also due to some chronic respiratory problems that were associated with their habit of smoking. So this means that we have to know how tobacco causes such health hazards and why we must stop smoking. So now that we have talked about some introductory points regarding the health hazards of smoking, so now we will move on and talk about the constituents of tobacco smoke. Now, tobacco smoke contains between 2,000 to 4,000 various types of substances. Among them, more than 60 substances have been identified as carcinogenic. That means they are responsible for causing cancer. And even many of the non-carcinogenic substances of tobacco smoke are also harmful for our health. So in the whiteboard you can see that I have written the major substances that are found in tobacco smoke and also their health effects. So first we will talk about these substances that can cause cancer. Now, tobacco smoke will contain polycyclic aromatic hydrocarbon, tar, nitrosamine, benzoalpha-pyrene, etc. And these substances are carcinogenic. They can cause various types of cancer. Now, tobacco smoke will also contain phenol that will help in tumor promotion, and also it will cause irritation in our respiratory mucosa. Tobacco smoke will also contain formaldehyde and nitrogen oxide, and they will cause mucosal irritation and also toxicity to the cilia. Now, what do we mean by this? Toxicity to cilia. Now, always remember, our respiratory tract is lined by a very special type of epithelium that is known as pseudostratified ciliated columnar epithelium. Now, let me explain the name. So, we are saying pseudo-stratified, that means false stratified. Now, what do we mean by stratified? It means multiple layer. Okay, but look at these cells. So, I am drawing these cells now. So, this is the basement membrane and these are columnar cells. Notice that the nucleus is seen towards the basal half of the cells, and also notice that their height is not equal. Okay, so they have unequal height. For this reason, whenever these cells are viewed under microscope, sometimes they may appear as multiple layer. However, note that all these cells are touching the basement membrane, so they are in fact not truly stratified. So that's why they are known as pseudo-stratified or false stratified ciliated columnar cell. And these are the cilia on their luminal surface. And what is the function of cilia? Cilia propels various particles that we had inspired with the inspired air. Those particles are propelled back to the environment with the help of the cilia. And formaldehyde and nitrogen oxide can hamper or can cause toxicity to those ciliary function. Now, tobacco smoke also contains carbon monoxide, and this is very harmful for our health as well. Let me explain. Now, normally we carry oxygen inside our body with the help of hemoglobin that is present inside the red blood cells. So as you can see, I have drawn a red blood cell here. So this is a red blood cell. Note that it is a biconcave circular disc-shaped cell, and if we view this red blood cell from the top, it will look something like this. So you can see that 1/3 is pale, which is known as the central pallor, and 2/3 of the red blood cell is red. And if we see the same red blood cell from the side, this is the side view, you can see the biconcave shape. It has concavity, one here and the other one is here. And inside the red blood cell we have hemoglobin, and under normal condition hemoglobin will bind with oxygen reversibly. That means when there is high partial pressure of oxygen, hemoglobin can bind with oxygen, and when the RBC containing such oxyhemoglobin compound is passing through circulation where the partial pressure of oxygen is low, the hemoglobin can dissociate oxygen and release the oxygen from the red blood cell to the tissue. So that is the normal way how oxygen is transported and delivered to the tissue. Now the problem is carbon monoxide can also bind with hemoglobin, and carbon monoxide has 200 times greater affinity for hemoglobin compared to the affinity of oxygen for hemoglobin. So what will be the outcome of this? Carbon monoxide will bind with hemoglobin and form carboxyhemoglobin compound, and when red blood cell containing carboxyhemoglobin compound are passing through areas of circulation where there is low partial pressure of oxygen, hemoglobin will be unable to dissociate carbon monoxide from the compound. So what will be the outcome? Hemoglobin is stuck with carbon monoxide, and that will reduce the number of available hemoglobin that can bind with oxygen. So that will reduce oxygen transport and oxygen utilization. Notice that tobacco smoke also contains nicotine, and this is very interesting because nicotine, as a matter of fact, doesn't directly cause any disease, but nicotine is strongly addictive, and nicotine is the reason why the habitual smoker finds it difficult to quit smoking. So always remember that nicotine is the strongly addicting component of tobacco smoke. And how does nicotine work? Nicotine can bind with the nicotinic acetylcholine receptor in the brain and stimulate the release of catecholamines from sympathetic neuron. And what will be the effect of catecholamine? They will increase heart rate, increase blood pressure. They will also increase the contractility of the cardiac muscle, and that will also result in increased cardiac output. So these were in short about the different constituents of tobacco smoke, and now we will move on and talk about the diseases caused by smoking. So as you can see, I have drawn a very simple diagrammatic image in the whiteboard denoting the major diseases caused by tobacco smoking. And also notice that I have given star mark besides the diseases that are more common. So what can tobacco smoke do in the oral cavity? It can result in cancer of the oral cavity. And also chewing of tobacco can result in such cancer. In the esophagus and larynx, tobacco smoke can also result in cancer. Tobacco smoke is a very important cause of lung cancer. And also notice that besides development of lung cancer, tobacco smoke is also responsible for development of some other disease of the lungs. They would include emphysema and chronic bronchitis. And I have a separate video entirely on emphysema, so you can look into that video for more information. Now, what can tobacco smoke do in the heart? In the heart, it can result in myocardial infarction. And we will talk about the mechanism after a while. In the stomach, it can also result in peptic ulcer disease. Tobacco smoke can also result in atherosclerosis, cancer of the bladder, cancer of the cervix, etc. And in case of pregnant woman, if the mother is smoking during her pregnancy, it can result in some problem with the fetus as well. There can be spontaneous abortion, preterm birth, and intrauterine growth retardation if mother is smoking during her pregnancy. So now that we have talked about the diseases caused by smoking, now we will focus on a very important disease, and that is lung cancer. So now we will talk about the relationship between smoking and lung cancer. Now, in order to understand the relationship between smoking and lung cancer, first you have to know about a term that is pack year. Now, what do we mean by pack year? So, it is calculated by multiplying the number of packs of cigarette smoked daily by the number of years the person is smoking. Now let me give you an example. For example, if I say 1 pack year, that means this person is smoking 1 pack of cigarette, that is 20 cigarettes daily for 1 year. Or this person is smoking 2 packs of cigarette or 40 cigarettes daily for 6 months. So both will be considered 1 pack year. Okay, so what is the relationship between smoking and lung cancer? Always remember, the higher the number of pack year, the higher will be the risk of development of lung cancer. And not only that, we have to also remember that smoking will also increase the risk of development of lung cancer from other influences. For example, it is seen that there is 10 times higher incidence of developing lung cancer among asbestos workers and uranium miners who smoke compared to the workers and miners who doesn't smoke. And also in your textbook you will see that there is also strong relationship between formation of laryngeal carcinoma when the person who is smoking is also an alcoholic. So whenever there is interaction between tobacco smoke and alcohol, there is increased risk of laryngeal carcinoma as well. So now that we have talked about the relationship between smoking and lung cancer, now we will briefly talk about some other diseases that are caused by smoking. Now, to discuss the relationship between tobacco smoking and other diseases besides lung cancer, now we will again go back to our diagram and recall that in the diagram I had mentioned a lot of diseases that were associated with tobacco smoking. And I had also given red star mark besides the ones that were more common. Now notice that in the lungs, besides causing lung cancer, tobacco smoke can also result in development of chronic bronchitis and emphysema. Now how will tobacco smoke result in development of chronic bronchitis? The thing is, the substances present in tobacco smoke can directly irritate the tracheobronchial mucosa that is lining our respiratory tract, and this irritation will result in inflammation and increase mucus production, and all these things will result in chronic bronchitis. Now how will tobacco smoke result in emphysema? In order to understand that, first we have to know what do we mean by emphysema. Now always remember, emphysema is one of the chronic obstructive lung disease, and emphysema can be defined as permanent dilation of the air spaces distal to the terminal bronchiole. And in case of smokers, or in case of heavy smokers, the centriacinar type of emphysema is more commonly seen than the other type of emphysema. So why will we have emphysema in a heavy smoker, or how emphysema will develop due to tobacco smoking? The thing is, tobacco smoking, like we said previously, will cause inflammation, and whenever there is inflammation, the inflammatory cells will come to the site of inflammation. A lot of chemical mediators, a lot of inflammatory chemical mediators will be released. There will be also a lot of oxidants produced, and these oxidants will also have a role in development of emphysema. And also there will be increased release of elastase from the inflammatory cells as well as from the epithelial cells in the area. So there will be local increase in the release or production of elastases, and all these things will result in destruction of alveolar wall, and that will enlarge the air spaces distal to the terminal bronchiole, and that's how tobacco smoke will cause emphysema. Now I have a separate video entirely on emphysema, and you can also look into that video for more information. So moving on to the heart, we had seen that tobacco smoke will result in development of myocardial infarction, and also remember that tobacco smoke can also cause atherosclerosis. It can also result in systemic atherosclerosis. Now, how will tobacco smoke result in systemic atherosclerosis and myocardial infarction? One mechanism is that tobacco smoke is associated with increased platelet aggregation. And again, also recall that when we were talking about the role of carbon monoxide, recall that it can hamper or impair the oxygen transport and utilization. So the carbon monoxide will result in impaired oxygen transport and utilization, and that will result in hypoxia in the myocardium as well. At the same time, the oxygen demand in the heart will increase, because recall that when we had talked about nicotine, we had said that nicotine had a role in development of addiction, and also nicotine used to release some catecholamines from the sympathetic neurons, and the role of those catecholamines were to increase heart rate and also increase the force of myocardial contraction and increase cardiac output. So since the force of contraction was increased, that means the workload of the heart was also increased. And whenever our heart has to work more, it will need more oxygen. So think about this. On one side, due to problem in the lungs as a result of smoking, and also due to the presence of carbon monoxide, the oxygen transport and oxygen utilization is decreasing, and on the other side we can see that the oxygen demand of the heart is increasing. So we are reducing the supply but increasing the demand, and that is resulting in hypoxia, and ultimately it will cause myocardial infarction. So that is the mechanism of myocardial infarction due to smoking. Just remember the key words. One is due to the role of carbon monoxide, and the other one is increased myocardial oxygen demand. And the other thing that you have to remember is that at the same time we are having problem in the lungs, and that is resulting in inadequate oxygenation. And all these things are resulting in development of myocardial infarction. So now that we have talked about the other diseases that are associated with smoking, now we will move on and talk about secondhand smoking. Now, what do we mean by secondhand smoking? It is passive smoke inhalation, where the person himself or herself is not actively smoking. However, the person is near a smoker who is actively smoking, and as a result the person is also getting exposed to the tobacco smoke. Now, is that a good thing? Obviously not. And studies have shown that non-smokers who are exposed to secondhand smoking or environmental tobacco smoking, they have risk of developing a lot of the diseases that were associated with active smoking. To give you an idea about the hazards of secondhand smoking, always remember that non-smokers who are exposed to environmental tobacco have 1.3 times higher risk of developing lung cancer compared to the non-smokers who were not exposed to such secondhand smoking. And because of the hazards of secondhand smoking, in many countries now there is a ban on smoking in public places. And for your exam, a very important information that we can now estimate passive smoke inhalation by measuring the blood level of cotinine. And what is cotinine? It is a metabolite of nicotine. So now that we have talked about secondhand smoking, we are almost at the end of today's video. The last topic that we will talk briefly is regarding how a smoker can quit smoking. So how can a person who is a heavy smoker quit smoking? Well, it won't be an easy task, but the good news is any person can quit smoking. And the first step in quitting smoking is to realize the reasons to quit. Why should we quit smoking? And in this video we have mentioned the major health hazards of smoking, and we have seen that smoking is not only harmful for the person who is actively smoking, but also for the people around the person. So when the smoker is realizing all these things, there is good reasons to believe that he or she will wish to quit. And often we see a lot of smokers who are saying that they are smoking for 20 years, 30 years or many years. So what benefit will they have now if they quit smoking? And the answer is smoking, it is never too late to quit smoking. Quitting to smoke at any age will definitely enhance your quality of life and also enhance and increase your length of life. So that's why always remember that it is never late to quit smoking. So the first step was motivation. Now what will be the second step in quitting smoking? The second step will be to make a plan. Say for example, it is not very practical to think that a person who was smoking 20 cigarettes a day for 20 years can suddenly stop smoking the next day. So we have to make a timetable or a plan, and the person has to gradually reduce the number of cigarettes he or she is smoking daily and set a goal that he or she can achieve and gradually make the number 0. And once he has stopped, there may be times when he or she is having an urge to again smoke, and those urges must be managed. So some behavioral modifications will be also needed. The next step in quitting smoking is to use some nicotine. Recall that we had said that nicotine itself is not directly responsible for causing any of the diseases that are associated with smoking. However, nicotine is strongly addictive, and nicotine results in the addiction that we had seen in smokers. So if we give the person nicotine without the other materials that are present in the tobacco, that may reduce the urge to smoke. And nicotine gum, nicotine patches, nicotine inhalers, nicotine sprays, etc. are available for that purpose. And in some cases there may be need for some other medications as well, and in those cases the physician will decide whether the person who wishes to quit smoking should take those medications or not. One such medication is bupropion. So this concludes today's video on the health effects of smoking. I hope this video was helpful. If you like my videos, do comment, share, subscribe and let me know. And for my students, I will also recommend you to go through your textbooks to know more information. Okay, that's all for today. Until next time, take care and stay blessed. Thank you.